time, male patients, as we age, our prostate enlarge, and then we have some problems urinating, and opioids per se will also make that worse. So that is something to take into account. And sexual dysfunction. Sexual dysfunction comes with hormonal issues, and we're going to talk about that later. When you're taking these type of medications, in male patients, the testosterone levels go down, so they go through an andropause or menopause. Yeah, and guys don't do well with that. We don't do well with that type of low testosterone levels. Cardiovascular side effects, there's the decreased systemic vascular resistance is just high blood pressure. So you will see low blood pressure. So instead of seeing high blood pressure, you will see low blood pressure that will make you more prone to falls or head injuries. It will also slow down your heart. So all that stuff, along with decreasing your ability to breathe, makes you more prone to stop breathing and die. So your muscles, and I have this talk with my patients when they come with a diagnosis of fibromyalgia or myofascial pain. Opioids are not good for myofascial pain. They're not the first line of treatment. They actually could make things worse because of something that is called opioid-induced hyperalgesia, which I'm going to talk about it later on. They may actually increase the muscle rigidity and cause myoclonus. Your immune system is affected. You may get release of histamine. Some people say that they take a pain pill and they itch, and that is seen mostly with morphine. And also your immune system will be suppressed. So you're immunosuppressed, which makes you more prone for infections. That happens also when you're going through withdrawals. I don't prescribe, not just opioid, I don't prescribe anything besides Tylenol if a patient comes in and she's pregnant. But the opioids or pain medications, they go through the placenta and they reach the baby. And then the baby, when he's born, he has some issues with that. And the hormonal side effects, your cortisol levels go low. You have increasing the insulin resistance type of a diabetic response, and you may develop the metabolic syndrome. You have low testosterone, low estrogen, so the hormones get dearranged, and that causes a lot of issues. Weight gain, osteoporosis, anemia, sleep disturbances, cognitive deficiencies. So all those are common side effects. And this is something that I'm sure that if that is on the prescription, when the pharmacist gives you that paper that tells you this is that drug and these are possible side effects, people won't take. But unfortunately, not all this is said in those papers. There's possibility of what is called serotonergic syndrome and seizures, and that happens in mixing these medications with some antidepressants or some medications that work also for pain in the central nervous system. And there's many muscle relaxants that actually work like antidepressants, believe it or not, and mixing those with medications that could increase serotonin levels may end up causing increased chance of seizures. So drug testing is something that needs to be done in patients that are taking these medications, not so much to see that the patient is taking the medication that was prescribed, but more to make sure that the patient is not taking something that they shouldn't. A big deal nowadays is THC, pot, marijuana. I mean, there's a lot of it in the news. There's some studies showing that it works for pain, and patients with cancer use it because it helps with nausea, and now it's approved for recreational medical purposes in different states, but not in Wisconsin. So until that is approved in Wisconsin, the use of marijuana is illegal, and patients that come out with positive drugs tests out of the clinic, they can be prescribed opioids. Most people that use it, and they ask me, they bring out all this research showing that yes, this helps with pain, but unfortunately, it's illegal in Wisconsin, so I can't promote or approve the use of that type of medication. Opioid-induced hyperalgesia, and this is what I wanted to talk about for those patients that have myofascial pain, muscle pain, tension pain, fibromyalgia. When people are exposed to the pain medication, actually the response of the body to pain change. And the more you're exposed to these type of medications, the less your body will be sensitive to them, and the more you're going to feel pain. So it's kind of contradictory, and people have a hard time seeing that. But the higher doses of pain medications, the more sensitive the patients become to pain, because the receptors, they get out of where they should be. It's called opioid-induced hyperalgesia, and in patients, especially patients with fibromyalgia, that they already have an abnormal perception of pain, this is something that should be avoided completely. Opioids will just exacerbate fibromyalgia. This is also one of the explanations of why patients sometimes will say, yeah, I did great for the first 3 months, but now it doesn't work. There's loss of efficacy. Okay, so when I talk about holistic approach,